started a couple days ahead of actually getting a diagnosis of getting just like hot flashes, what felt like a hot flash. And I would just feel like I was burning up, and then it would go away. And so I really didn't have any early symptoms other than that. And I guess I could say I had a headache. And then I worked on that Monday. That was on a Sunday. And on the way home, I started not feeling really good and actually kind of felt flu-like, to be honest. Got home, I was freezing, sat on my couch for a little bit, wrapped up in a blanket. I took my temperature and it was 102. And so I immediately thought flu or COVID. And so I'd gotten up the next morning and I needed to get a COVID test. That's the first thing that we always have anybody do if they're running a fever. The day that I actually got the positive test, I was already experiencing some shortness of breath, some tightness in my chest, and I had the worst fatigue I've ever had in my life. So I did the test, got the positive. I called my boss back and let her know that I had the positive test, and then that's when I was told about the antigen infusion. I have an autoimmune disorder. I have rheumatoid arthritis, and I take a medication that weakens my immune system. And I know that kind of puts me at a little bit higher risk working with these type of patients. And so my coworkers, knowing I had that, called and said, "Hey, do you want to do the infusion?" And my first thought was absolutely. And so I took it early that morning, that Wednesday morning, about 9 o'clock. And I didn't feel great most of the day. I actually went to bed early that night, not feeling very good, real short of breath, especially when I was up moving. I got up the next morning and I felt wonderful. I cooked Thanksgiving dinner for my family, and the only thing that I really experienced was I still had some fatigue. Wasn't as severe as it was prior, and then I also would still get those hot flashes, like a little bit of a fever. But other than that, I honestly didn't really feel very sick, and it weakened what kind of effect I would have had with COVID. I potentially could have been in the hospital. I could have been one of those patients I take care of, because I've seen what not having that treatment is like. I mean, I take care of these patients on a daily basis, and it's heartbreaking and devastating, and it takes a toll on the person, takes a toll on that person's family, because I'm watching these people here and knowing when you come in the hospital, you're not going to see your family until you come out, or till things get really bad and we have them come in to say goodbye. And so if there's something out there that can prevent you from going that far into that disease process, absolutely do it. It didn't really change me until it started hitting us, till we started seeing more patients, and it's not even just about seeing more patients, it's about seeing how critical these patients are. I go home physically tired, but I go home emotionally tired, and that emotional exhaustion doesn't go away. It stays on my mind. I call up here on my days off. How's that patient doing? Because we're their family at that point. I talk them into being calm and breathing and thinking about every breath they take. Just take it in and let it out. And it's hard. It's hard to watch. And because of what I see and what I have experienced, I say wear your mask. If you get COVID and you come to Wilbarger General, you're going to be treated like family, because you are. I've never worked in a facility that cared more about their patients. You will never know that you aren't the only patient in there, because when I walk in your room, you're the only patient for me right then. That's just how we all do it, and I'm proud to be a part of this facility. I'm proud to be a part of this team.